we have quorum. We have enough people to start our meeting. Welcome, everybody. Hope you all had a really good, nice, comfortable, relaxing summer. So I would, we have a couple of things to clean up beforehand and do some introductions. So we do have a new member, Kristen Roberts. So,
Welcome.
Thank you.
Kristen, could you just tell us a little bit about yourself?
Sure. So I originally from New York City, but I moved to Worcester in 2017 after having lived overseas for a few years. And I had attended the Bears Civics Academy, and it actually motivated me to do something for the city after learning everything about what's going on and whatnot. And I heard about the Elders Commission, so I took a keen interest and wanted to at least contribute back to the city in any way that I could.
Great, thank you.
Thank you.
Definitely welcome to our board. Okay, so I need to get minutes approval for the attendance of June 23rd commission minutes. Do I have?
I motion.
Thank you. Do I have a second?
Second.
Thank you. But I also looking to get, all in favor, speak at that part. All in favor?
Yes.
Any opposed?
No.
Thank you. Do I have a motion to approve May 19th commission minutes and September 9 senior center committee report? You can see it.
I also motion.
Do I have a second? All in favor?
Aye.
Any opposed? Thank you. I also would like to confirm that our next meeting will be October 27th at 4 p.m. and it will still be here at the senior center. Okay, so today we have our guest speaker, which is Dr. Maddie Castile. We're really honored to have her here today, especially where this is her next to last day at our human health service. So we are very honored to have her. I'll turn it forward to you, Kay.
So hi everyone, thank you so much for inviting me. I want to just give you a little preview of, I don't know, I'm assuming all of you know that the Senior Center Elder Services actually falls under Health and Human Services. And so I've been in this position now for 10 years, and I'm retiring tomorrow. You see the smile. But just wanted to at least to tell you a little bit about myself and sort of, you know, what we've done over the last 10 years overall in Health and Human Services. And I'll tell you a little bit about me, because I always think it's important to know, just like I now know that you were from New York and came here. So knowing a little bit about everybody makes us closer to one another, and I think that that's one of the things that we miss out, is that ability to get to know one another. We need to make an extra effort to do that. So I'll tell you real quickly, I am a native of Cuba. I was there till I was 7 years old, and I came in what was called Peter Pan Expedition, when 14,000 kids left Cuba to come to the United States. We were fleeing communism, and so my parents sent us out. They could not come themselves, so just I was 7, my brother was 8, and we came to the United States. And I was supposed to end up in Boston, but my mother said I was allergic to the cold and to down, which I assume I'm still allergic, really, but that's what she said. And so I got sent to California, and thank God I did. I grew up in California, at least from 7 on. Went to med school in San Francisco, residency in St. Louis, only to meet my husband there, who said we'd come to New England, the place that I was supposed to start, and would stay here 2 years, and that was 36 years ago. Since then, I have 2 kids, Adam and Zachary. Zachary is my youngest. They're 13 and a half, 13 months apart. And these are my grandkids. That's Cece, and this is Emmy. I have to call her my granddaughter also. And my son Adam, who's the oldest, is this is his son Owen and Gabriel. And so just to get to know my family. And then when I came here, I practiced medicine for UMass Memorial. I did the emergency room for a while. I also worked at Family Health Center, went back to Family, to UMass Memorial, and did clinics throughout the Worcester housing site, especially elder sites that I had most of my clinics in. And while I was doing that, I met a gentleman, actually I was on the board of Central Las Americas, it's called Centro now. I met a gentleman named Hector Reyes. This is Hector Reyes, who was also on the board, was a man who recovered from addiction and felt that people who were Latinos were unable to access care, and also culturally sensitive care, which is one of the things that we try to do, is how do you make people feel more comfortable, and if they're in a culturally appropriate area, that food's the same, language is the same, that people tend to recover. So I worked with him to try to put a treatment facility for Latino men, not knowing anything about how to do this and how to access it, but always I want to say that we can always do whatever we need to do to make a better community. And this is the program, it's just down the street from here, it's called the Hector Reyes House. One of the people who helped us do that was John O'Brien. He was the CEO of UMass at the time, now it's Eric Dixon. But he was somebody who really was involved in the community. He gave us the boardroom, all the things that we needed to start a nonprofit, which is what we did to put this program together. One of the things we wanted to say was that, you know, to make people, and most of you know that addiction is a huge problem that's happening in our community, and sort of how do we deal with it, and most of you may also know that people have been incarcerated for long periods of time who suffer with addiction. If you look at our jails now, about 90 to 95% of the people are there because of something that happened secondary to addiction. And I also want you to know that addiction isn't because somebody can't pick themselves up by the bootstraps. We also think about addiction as a childhood disease, that the average age of people starting to use any type of drugs, whether it's alcohol, cigarettes, marijuana, is 13 years old. So it really is a childhood disease, and we need to start preventing it at that age, and then still working with people to reassure that we can end in some way addiction. This is sort of what the transition house, this is Hector Reyes' house. It's a 25-bed residential. This is one of the transition houses, Casa Reyes, and this is Casa Maddie. And part of the idea is learning about the social determinants of health, that you do it as you go along. That's how it happened to us. We opened in 2009. People didn't have a way to work, didn't have any job training, and certainly couldn't afford housing. So part of it was getting them housing, which is what we struggle every day when we talk about who's homeless in our community. And most of you may know that really the numbers that are the highest now, increasing, almost matching the middle age group, is seniors. And we're seeing increased numbers of seniors in the shelters. So trying to figure out how to help them. But one of the things that is important is sort of even your job is what you do and how you connect with the community, and the trust that you build in the community is incredibly important. I don't know if you've heard about trying to cite something in any part of the neighborhood. Nobody wants any type of treatment facility. They don't want homeless people in their communities. But if you build a rapport with people in the community, you will never see something that says Latino Rehab Center. And that's from being a doc and being able to connect to the community. And half of the people that were living in that area were actually my patients. And then how do you give people, and this applies to every aspect of things that we do, how do you give them training that they never had training? So actually, this program that is here at the Senior Center, when the Sigma community does the culinary arts, they trained all of the men to become prep chefs and to learn safe surf. And so that was done here, actually. So consequently, we opened up a restaurant called Cafe Reyes, which is on Shrewsbury Street. And so it's a job training program for men in recovery, but started with the training here. And again, not just for people in recovery, I think the whole world needs a little love, and if you give people love, people tend to do better. And this is some of the men at the program celebrating holidays with us. This is the restaurant on Shrewsbury Street. And then part of it is also graduating people and giving, and making sure that people honor the people who are graduating, that it's not anonymous, that it's a disease like any other disease. And so when people graduate the program, we celebrated. We did things like giving back to the community. We did meals at Worcester Housing Authority, and mostly for the elderly. And so this was a piece for them to give back to the community, which is incredibly important. We visited places. We went to Cape Cod. This is a Puerto Rican gentleman who says that this is how he goes swimming in Massachusetts. You can only put your finger in because it's too cold. And so so I practiced medicine, and all of that stuff was done as a volunteer. I did that along with my job. And then in 2015, a friend of mine handed me some papers and said, hey, would you like to do this? I think you'd be good at it. So I applied to Health and Human Services to be the Commissioner of Health and Human Services, and ended up getting that position, not knowing a whole lot about what municipal government was like, but truly have enjoyed it. If you can see that overseeing Health and Human Services encompasses public health, elder affairs, youth opportunities, veteran services, and human rights, which 2 years ago moved over to diversity under human resources. So this is where is Amy here? There's Amy right there. So we've had retreats to look at, to figure out how we all collaborate with one another. How do we share our vision of what we see through overall over Health and Human Services, whether it's an addiction, whether it's mental health, whether it's whatever aspect of equity. We've done some cultural meals together. What are some of the things that we could collaborate? And that was the idea of having retreats so that we can all talk about it. I don't know if you recognize anybody else yet.
Linda is there.
Oh,
And found Linda. At the bottom.
And Patty.
Yeah.
Suki.
Suki's there?
Yep,
Yeah,
next to
Suki's
Patty.
there. Suki's standing in the white jacket.
Just her head?
Left, to the right.
Okay, oh, it is.
Yeah.
I see. So, like I said, lots of different things that happened during my term, and that we all collaborated together. I think one of the biggest ones, obviously, was COVID and what we all did together during COVID. This was our cabinet when I first started. Most of you know that Augustus was our city manager for a number of years. I think he came the year before me and stayed probably 8 years. So I beat him in that sense because I'm 10. So this was the group that we had there at that time. And then this is some of the things that we do in Health and Human Services. And this is the Community Health Improvement Plan. If you've heard about this, it comes together from a community health assessment point of view that they'll go around in the community and making sure that all the voices are being heard about what's important in the community and how we solve those issues together with all the different agencies in the community. They call this the roadmap to really figuring out how we help the community. The granting processes, all of that falls. People look at this, and if you have something here that you're applying a grant for, you're more likely to get it. And this comes out every 3 to 5 years, and so we have to do the community health assessment again every 3 to 5 years. And this is part of the first thing that we did was when we first started in 2015 was really to do syringe exchange. And syringe exchange wasn't so that every needle on the street would be picked up. It was really meant to be that our numbers for hepatitis and HIV were going up, and to prevent diseases. And so that was what the whole point of doing syringe exchange. I know people say that there's still a lot of syringes on the ground. yes, and ideally, they're supposed to bring it back, and most people with diabetes and every other medical problem that uses syringes will bring them back. But unfortunately, when people are actively using, they forget. There's a good portion of them who do not return, and so there are people in the community who go out, and same from the city, to go out to pick up syringes. But it is a problem that we need to work together to improve. We took the idea of going out into the community, even with the senior center, who did a lot of work and having AA meetings here to really bring awareness about addiction, but we took it out into the different schools. We took it out just every area that we could go to talk about changing the stigma of addiction. And so, and then we went nationally to talk about how we changed that, you know, the thought process about addiction and how to treat addiction, and that medication does work. How do we do that? And then people always tell me that I get into good trouble, so I got my counterpart who also gets into good trouble. We did a lot of work on mental health. This was the Mayor's Mental Health Task Force. It actually came out of New York. The Mayor of New York put a group of all mayors together to talk about mental health. Our mayor couldn't go, so I went in his place. But it brought back lots of things about mental health awareness in our community, mental health first aid in the community. And so since we came back, we've been out, we have a mental health task force that we've been working with people with different issues in the community, whether it's changing stigma, whether it's workforce training. If you know, it's hard to get in to see a clinician. So how do we build up more clinicians? Clinicians of color are difficult to get, and so how do we build up, among other issues regarding mental health? We even tried to put a social work school out of BU here. It was called Wheelock, and that lasted 2 years. But we tried. There's a lot of things that we tried, we didn't succeed, but we continued to work on the issues. This is just talking about how they were dealing with addiction when I first got here, and this was, the method was, you go to the police station. This was Gloucester's method. You go to the police station, say you need help, and the police station will help you try to find resources. We brought it back. It didn't quite work here, but these are all things that we tried to do in our community. One of the things we started was outreach. Quality of life, I know, helps Amy out a lot when they have issues and they go out into the community, both to clean up the community and to provide resources in the community. We didn't have a group when I first got this job. It was just me alone, and so I wanted to do outreach. If you aren't out in the community, you're not going to know what's happening in the community. So how do you do this? And so part of us was going out into the community and looking to see and seeing the homeless community, what was happening to them. So after that, we ended up, we never had an outreach team, and the only person that was doing anything with homelessness was in economic development. So we brought that person down to Health and Human Services and developed a team starting there by having somebody who did outreach. We hired recovery coaches, and they go out into the community and try to provide services in the community. Do you know what's the missing link for people who are homeless that we don't have in the city very much? What do you think? Shelters is definitely one of them. What do we want outside of shelters? What do we want over their heads? Housing. And housing has been difficult, and so we had task force. So in 2017, we had we started the Housing First Coordinating Council to start providing housing. We said we develop 103 units of housing. We've only reached in the 60s is where we are right now. So we're short from something that we said in 2017, let alone that our numbers are continuing to increase. This was something that our staff and myself worked to see. This is the Quality Inn Hotel on Oriole Drive that we're trying to put. We were able to garnish resources, or I should say resources, community, to be able to buy this property so that we could put 90 units of supportive housing. Worcester Community Housing Resources is the one who's actually developing the place now, but it still will be a couple of years. And this was started in 2019, so you can imagine how long it takes to provide housing. And they probably will not be ready to 2027. And this was just one of the things that we did was, we also had a task force, a reentry task force, to look at what happens in jail. And again, because they're people with addiction, how do we change that course of when they come out and what do we do? But also inside, how do we start treating people there for addiction? They treat diabetes, they treat hypertension, but they never treated people with addiction. We tried every which way, we weren't able to do it, but finally, the state's attorney passed that all jails and prisons should be given medication treatment in the jails. These are some of the encampments we saw in the community. And I'll talk a little bit more about homelessness, but one of the things we also did with homelessness was we started Women Against Sexual Exploitation. These are women who are trafficked in the community. And most people don't know how many there are, but there are an incredible amount of women who are being trafficked. Our shelter at SMOC had maybe 15 women who were there. We actually got somebody who had been trafficked, who was in recovery, and used an area that SMOC has for a shelter, and those 15 became 60 women that are actually there right now. And we're not even in the winter, as you know, probably in the winter is when everybody's looking for shelter. This is 60 women that are trafficked that are there, and still there's a waiting list for people to come in. This is the woman, Nikki Bell, who runs it. And this is, we went really through conferences, whether it's statewide or national-wise, to talk about trafficking and how do we assist. Like, she'll tell you the story that she went to the emergency room and nobody asked her, and she's been doing this since she was 16 years old. She was pregnant at 16 years old, went to the ER by herself, but nobody once asked her, you know, how did this happen to you? What's happening at home? No questions. They just were treating her for the pregnancy, and nobody asked her any further questions. So how do we bring awareness that this is something that's happening in the city, and we need to be able to identify it? I always talk about collaboration, and collaboration is probably the most important thing that we could do as a community. We did it during COVID, and it's probably the best thing that ever happened was to be able to work with all other agencies in the community. We were all sort of rowing in the same direction. And so we did this with, tried to do this with the 14 largest health departments, and we collaborated with them. And we continue to collaborate with them to be able to know what's Somerville doing, what's Fitchburg doing, so that we could work together to at least look at policies and how do we work together to change policies. This was always controversial, but there was a reason to do this. And when you see people on the streets who have substance use, how do you bring them in, and how do you, even though they're going to be using drugs, how do you bring them in to be able to offer services? And so this is on point in New York. It's one of the safe injection sites or overdose prevention centers. The data behind it shows that no one has overdosed in an overdose prevention. Nobody has died. They may have overdosed, but they don't die in this place. And this is how to really prevent deaths. One of the ways to prevent death from people with substance use is to give Narcan. So we started giving Narcan out, and those numbers of deaths has markedly decreased, but still we have substance use that we actually passed it through the Board of Health that we could do state consumption sites, but we needed the state to approve it, as they did in Rhode Island, and the state has not approved that yet. So we're holding tight now, and it's not a good time right now. Do you recognize this place? It's the senior center. But I wanted just to mention at the senior center we've done some pretty impressive work, whether it's been on collaborating together with all the different groups to bring culturally awareness and to bring food that is culturally appropriate. We think that one of the best ways to communicate with people is actually to put food around you, and people start talking and feeling comfortable, and that's one of the things that happened here, along with being able to do the culturally sensitive food with Meals on Wheels that they also provide that same. We certainly did work on addiction care, health care. Dr. Hirsch comes here and gives those talks. The gym, all the new things, gym inside, gym outside. So pretty impressive things that is happening here. youth department is also up here, and they run, summer camps, for people who can't afford, to go to camp. It's all free, and they do it after school. And also now run grants such as the Shannon Grant and the Youth Violent. These are both grants for youth at risk. And so, it's part of what the youth department does, and it's on the third floor here. And then, we still continued. I was always the doc, even while I was working at the city. You know, once a week I went and had clinic at the program, and still graduated folks from the program. One of our colleagues, Leah Maroney, who works with us, started what's called the Hub, and it's something that's used throughout Massachusetts. And it was always a police model. We brought it into our HHS, so it's a model that has health and human services in mind. We have a social worker that's also part of this group, and so what it does, it brings people with high risks into this group of people, which is made up of all the agencies in our community. And so who's gonna wrap themselves around somebody who's having issues, somebody who's homeless, somebody who's hoarding, all the issues that can happen in a community. And I think you brought up folks into the Hub, have you? Or you participate in the Hub?
Yeah, I do.
Yeah, so, and if it's a senior, how do they work together to be able to assist a senior who's homeless or a senior who's at home and has risk factors that we need to assist with? I think we went through, Adrian Zai was somebody, this is this gentleman over here. We really went to the State House to figure out how Mass Health helps with providing services. One of the things that we see when we try to house people who have mental health issues, who have addiction issues, that if they're in housing and their services aren't there, they don't last very long in housing. And the services that they provide is very minimal. So when we talk about housing somebody and we say housing first, we're talking about bringing services to people. And that was the original plan, but the services are incredibly weak. So trying to figure out how we make them stronger. And so this guy went on to become the director for Biden, for Mass Health.
Do you know that he's now basically in your position in San Francisco?
No, really?
Yes. Yes, there was a New York Times article in the last couple of months.
Really? Well, I'm going to San Francisco in 2 weeks. Maybe I'll look him up. That's very cool. But he did work for Biden during that entire
Yes,
time.
and he was
Yeah.
the medical director.
Yeah.
of Com.
Yeah. One of the things we also started was, our shelter is very small. Started with 15 or 25 beds was the small shelter. It didn't grow in size per se. Yes, they added bunk beds, and then it became 30 people, 50 people, 75 people, same size. This past winter, there was 175 people in the shelter. And so, what we've done in the past, and a couple of, at least 6-7 years ago, when the numbers started to increase, was an overflow shelter. And this is some of our staff providing meals. We did it at St. John's. They did it for a couple of years, and then we've been moving to different places to do a winter overflow shelter. This is one of the ideas that we had for a shelter. I shouldn't say it was our idea. It was an idea that was brought to Massachusetts about, these, what are they called? Yeah, but, I guess it's modular, it's easy to make, but the idea of it is that people live in these shelters and they're all packed into a group there. They're sleeping on mattresses on the floor. I mean, if you're talking about giving dignity to people and the ability for people to recover, that's not the place to do it. So this at least gives people, this is for a couple, it gives them the ability to at least not be surrounded people, give them some independence. But we never got to do that. I'm telling you my failures as we go along. This is one of the things we did do was a shelter it was on the west side called Blessed Sacrament. So when we do shelters, the way zoning goes, on the west side, you're not allowed to do any of that, any of housing for homeless or treatment programs. None of that stuff goes on that side. And so we were actually able to, the priest in this shelter said, yes, we can do a shelter there. It was It was good for the people that were there for a limited time, and for the community, it was hell for them. I mean, they felt that this was not something that they wanted. If they saw feces on the ground, they said it was, you know, it came from the homeless person. It was just something that was a negative for them, and certainly for all the people at the end of it all that they went through it. But I think part of what we need to do is be able to say that that should be happening everywhere, that we should all support people who are homeless, people who have mental health issues. And so, things we have to work on. We started COVID, and then it says, my thing says, fight for the things you care about. I think that's the most important thing. So we opened up a clinic. I mean, I think if you don't think that treating people who are homeless and stabilizing people makes them even more ready for them to go into housing. So we did a ribbon cutting for the clinic that was actually put together by volunteers, and it has a clinic there 2 hours a week is all we have so far. This was also a model of something that we wanted to do. It's actually in Quincy, which was a day resource center, housing, medical care, in one spot, at a shelter in one spot. We designed this, we worked with WPI and others in the community to put something like this together. We had a property, but it is now going to CMHA. They bought a building, and so hopefully in 2026, 2027, we may have a day resource center. When people say, what are you doing with homeless people? Why are they around here? Where do they have a place to go? They don't have a place to go. And so how do we build them a place that they can go, they can spend a day there, and that is what a day resource center is, and that gives them services. I think we talked today about a front door for people to access services. Sometimes they go throughout the whole community trying to figure out where to get services from. So hopefully that'll be it. The other thing that we worked on for a long time was crisis intervention, sort of the 911 response. Most of the 911 response comes from the same vulnerable areas in the community. And so how do we decrease that? What kind of assistance can we give to people in the community when they're having, whether it's mental health issues, whatever it is that we send clinicians, case management out to the community. This was a pilot program we started. It lasted 2 years. CHL, due to finances, was unable to keep it up, but we are still continuing to work to see who will take this up. We do things like the vigil for homeless, the longest night, that we get people together to make, everything is to make people aware of the issues that are happening in the community. This is just a part of the vigil that we try to do. We also do the overdose awareness vigil in the community to remember those who have died secondary to overdose. We do a recovery coach to actually think about the people and who have actually gone through recovery and are, can say that recovery does work, does happen. We brought into the city what's called mobile care, which actually we brought it in for UMass, and they run the Road to Care. I don't know if you've heard the Road to Care that goes out into the community and provides medical care, because the best way to really provide care for the most vulnerable is actually to go out into the community, and that's what the stand does, along with our outreach workers and others in the community, to be able to do that. So UMass is running that now. And again, a lot of collaboration with WPI and all the colleges to do things. This was an app that we put together in conjunction with WPI that was called Stigma Free Worcester, so that it's actually in your hands, that you can look up where the shelters are, where food is, where housing is, where food, I said food, but mental health services, all of that was in the app. It just got turned over to the med school, so that they will continue it. But if you can see it now, it's called Stigma Free Worcester. We passed comprehensive sex education through the Board of Health, and so that is happening. I was part of the Health Policy Commission looking at what's happening in certainly in Massachusetts with healthcare, the cost of healthcare. what happens to families and people with their insurance, how costly it is in trying to keep those costs down. And then we also, we're part of the Health Equity Compact to really look at how we change inequities in Massachusetts. So again, part of our outreach to talk about inequities. And we talk about the Chancellor's Medal because in medicine, how I grew up with medicine, it was always the researchers and who always got any type of award. And this award was given for community medicine. It was something that you don't see very often, and so it was that's me crying when I got it. We put a feedlot. I don't know if you guys have gone through University Park. It's again vulnerable neighborhoods that don't have a place to exercise. That obesity is an issue, and how do we get them to exercise if they can't afford a place and put them right in their backyard so people can exercise? And then there was COVID, and we went around and really had what do they call it? Town halls to talk about so people, all community folks, can understand what COVID was about. And we ended up getting a mobile van that was actually Greater Worcester Community Foundation gave us a van, and we went through all the vulnerable sites. We were able to test people, and we were also able to vaccinate people in their places where they worked. We walked the streets. We gave people, whether it was in cars, in barbershops, hair salons, we gave vaccinations everywhere. This is one of the shelters. We opened up shelters in the schools, in the places of worship, and we were able to vaccinate there. And then most recently what we're trying to do is build 4 tiny homes as a public health model to show that as a community we could build housing. There's Integrity is the modular homes here in Worcester, and so we're putting up 4 tiny homes for seniors in the community who are homeless, and that it can be replicated as not waiting 5 years to get housing, but as a community we could do this and raise the money. So that continues. We're opening up a shelter for seniors, and we're opening up a treatment program for substance use that should be both be coming on right after I leave, but we've been working on it. Any thoughts, any questions?
I have a question. Obviously, you're retiring as of tomorrow, but I assume some people will be reaching out to you for advice. So let's say in 5 years, in 2030, what do you think will happen with regard to demand for services among seniors? Let's say those who live here in Worcester. Demand and supply. What kind of gaps are you expecting?
Huge gaps. And I think, we talked about this all the time, that the baby boomers are retiring. And what are you gonna do about the baby boomers retiring? And, we say we have a lack of workforce. We knew we had a lack of workforce, and it was gonna get progressively worse. We have a lack of primary care physicians. We have, everywhere you look, that's what's happening. I think people are trying to bolster up in whichever way they can. But it is an issue. It is an issue that's gonna continue to get worse. I mean, I'm in my 70s, so imagine 5 years ago, it's already been happening, if not in 62, when they were 62 and all that. 62 years old and people were retiring. I am hoping that people get that. I mean, that's part of housing that we need to do, that sometimes people will not be able to afford housing. How do we get more housing for seniors? I know that there will be housing right outside here, but these are all things that we've been trying to figure out. But we even having a senior shelter is incredibly important, just to provide, because the demands on a senior in a shelter is medical care. It's all the issues that come with being a senior. So we can have a shelter that provides medical care. If they didn't want to do it at the shelter, then let's get a shelter that does provide medical care, and those are the intentions of that. But I do worry about that. I worry that things may get a little worse in that sense. But I think now, it takes a lot of, I don't wanna say slap around until people actually realize that this is a huge problem that, when people retire. So, yeah, I agree, and I don't know what will be 5 years from now, but I hope that we continue to develop housing, that we continue to figure out in medicine what we're gonna do, and I think there's practitioners, they're increasing that aspect, but we need to do much more than that.
Somewhat related to, oh, sorry.
No,
There
go
was
ahead.
someone else?
Go ahead, no, go ahead.
So, shortage of PCPs. Actually, myself, I still have a PCP in Boston. I kind of give up on finding one here. But I assume for seniors it might be even harder to find a PCP, especially if they're somewhat new to the area. Is there something that, obviously, the city cannot train doctors. I understand that part. But is there something that the city could do to, I don't know, maybe offer space to willing, PCPs, willing to move here or work here, or prioritize this population?
But that's happening across the country,
Mhm.
so that's what's hard. I think the goal is to start increasing people to go into primary care, and that's some of the things that have been happening, like whether it's high school kids or college kids, to get them to go into medicine, into primary care. I think also making primary care more, I don't know if the word is humane, but when you're in primary care, you might see a patient, you might finish at 3 o'clock, and then you have 8 more hours of dictations and trying to, all the pre-authorizations that you have to do for people, the amount of paperwork. Even a specialist will say, go see your primary care, have them fill out the paperwork, everything comes back to the primary care, and yet they're the least paying profession. If you ask Eric Dixon from UMass, he says he loses money in primary care, and how do we say that we can't function without primary care, and you need to bolster that up. So there are things happening at the State House to figure out how we increase primary care and how we provide some support for primary care, whether it's all that paperwork that somebody else is doing. How do we do all of that is incredibly important. But I think access for seniors is access for anybody is difficult now. I always like the front door process that you can walk in and somebody will help you instead of making a phone call. That would be the ideal for me in any kind of services. You're talking about maybe you or family members trying to get in. Think of somebody who can't speak the language trying to get in, or who doesn't know how to navigate the system. And those are the reasons why we have such inequities. If we look at a black community and a white community, much more inequities there. So what things do we need to look at? And hopefully at the state level, they have a whole primary care task force that is looking at that to see how they can improve that.
The timing for the shelter opening for seniors and the tiny homes, if you know what the timing is, and who should we be in touch with? Who's carrying the ball? I hope it's not. It is you and your retirement.
Yes. So we are actually going to plan, because yes, I'm retired, but it doesn't mean I leave the community. I still want to do some of the work. And so the tiny homes, we're going to planning committee this on Wednesday? October 1st is Wednesday. That's when we're going to planning committee. We have raised the money. They will build those tiny homes in the factory and then just move them there. We are thinking that hopefully by the fall, those will be in. And yes, if you want somebody else besides me, Worcester Community Housing Resources is working on it, and it's a team of volunteers. Senator Chandler is also a part of it. We have a volunteer, Todd Rodman, who's the lawyer, Sean Brennan, who's the architect, and it's just getting a group of people who volunteer their time to be able to do it. And those are all the things that we can do as a community. The shelter hopefully will open up for this winter. And again, I will be working with him on that. And Dr. Amida is the person who's going to run the shelter.
believe you mentioned, so the shelters will be for elderly people with SUD, right?
No,
No, with-
yes, with substance use and anybody who's substance use, homelessness, mental health will be part of that. So when we talk about homelessness for seniors, we talk about 55 and above, so it's anybody 55 and above that can come into the shelter.
Is, it's not exactly probably the same population, but I remember during COVID, those who follow the news, I don't know, sort of about things happening in Boston, the whole massive gas crisis happened. And I remember EOHHS built a few of the modular homes next to Lemuel Shattuck, which is EPH Hospital.
Right, I'm trying to
Forest.
think what we call them, container homes. That's where the one I was showing. They were
So,
containers,
yeah.
sort of like that.
And if I'm not mistaken, they discontinued the program. I might be wrong.
Yeah, they did.
They did.
They did.
So, is there any basically any lessons learned from that experience? Because it was probably a younger population, but the population did have some of the same issues. Is there anything to learn from their experience?
I think that should be a method of care for the shelters. That it's individual rooms where people have their privacy, the ability to start, feeling good in some way by not being overrun by a bunch of people who all have all kinds of issues in the same place. When we talked about the hotel on Oriole Drive, the Quality Inn, the intention was that we would keep housing first. What's housing first? I'm going to take you from the street, I'm going to put you in housing, and I'm going to provide the services. That no one will recover, whether it's from mental health issues, substance use, if they don't have a roof over their head. If you're outside, why would you want to recover? You want to use more drugs so that you can feel better in some ways of your position that you're in. I took a walk through St. John's, that whole area where the food pantry is, and people are just lying on the streets, on the sidewalk. No mat, no nothing, just lying on the street. I don't even know how somebody could do that. But I also think that how in this day and age that we can look at that and say that's okay, and not think that that is an urgent crisis that we need to be able to assist people with. And me, who came from a communist country, we say, how in this country do we allow it? Because you can go to Cuba and you won't see them.
Any other questions for Dr. Fisthiel? We thank you so much for
Thank
all
you.
that you have done.
Well, this is from the commission, and what I've said many times is that you look at your perseverance and results and compassion. You as my supervisor. Thank you so much for taking the time. You're incredibly busy schedule.
Thank you. I did have something at the Holy Cross, and I was more excited to come to you here. So thank you.
Thank you.
Thank you.
Pleasure, and I will be around, and I'm going anywhere. Thank you.
Thank you.
All right, so we will move on. Amy has her director's report, and she's also going to report for Patty today as well, because she is out.
And I'll start with why Patty is out. She and a couple of other staff are at Holy Cross for the caregiver summit participating on Dementia Friendly Worcester and Week of Dementia Friends. So we're very happy that outreach and training is going on. The first page of the report, I'm gonna just stumble through everything quickly. I cut out one section of how I used to report, and now we just start off with the various goals and objectives that relate to the city manager's strategic plan that goes till FY '29. And I'll be doing monthly reports on how we're doing with supporting this work. And I'm just gonna strip it and suggest that you take a good look at it when you have a chance. On the next page, we go into our goals and objectives that we've been doing for over 20 years, but are still quite relevant. Maintaining funding, of course, is essential. The city continues to be a generous supporter with $1.1 million. And this FY '26, the state legislators have increased our funding. However, we're being very conservative in our spending because the governor has made it clear that they may have to take some and use it for, if the revenues don't come in well or whatever. So, but if all goes well, we have $639,000 from the State Council on Aging Formula Grant. We're in our 4th year of 5 years of fitness from Fallon Health. So that's another $40,000 subsidizing our health and fitness program. And yes, we are planning on what happens after the 5th year is over, because it goes so quickly. We receive full funding for consumer rights. We got a special field demonstration grant from Mass Association of Councils on Aging to expand our behavioral health program for men. And we just got a very much needed food security infrastructure grant, which is really basically a grant to buy kitchen equipment. Now that we've been open for 25 years, things need to be replaced, updated, etc. So, well, we're getting that funded. I meant to mention July was the beginning of FY '26, and this is a July through September report, so it's the first quarter. So you'll see 1 million, or at least 137 programs listed that we did on the site. I like to start fresh, so these are programs, some of them we've heard about last year, but many of them are new. And then we have our different remote programs, the various ones that are showing on TV this quarter, but of course we have many more online on YouTube. You also, I don't often give out the newsletter, but it came in today, which is always early. And I figure I don't have to talk about programs much. Patty's not here, but you can read the newsletter. I really, really hope you either send $20 to the friends to get it online, or you go on, to get it sent to your home, or you go online to page 3, tells you exactly how to get it online. are working hard on resolving it. Staffing remains stable with our excellent team. Fantastic team. We're implementing a new organizational education plan for our monthly staff meetings, so we all know a little bit more about what each of us are doing to build the team. Our tendencies have changed a little bit with RCP, funded, or federal funds. And also Prime Movement, our personal trainer, that's Rhonda Hammer, is still instructing here, but she, it doesn't need her office anymore, so we lost a little bit of that. But we need space, so we've been reorganizing space. We still raise, almost $76,000 that go into the general fund for the city. Rogerson Communities is still very enthused about developing senior housing, in our vacant space. And this news point, I could knock harder, but I believe they will be coming to our October commission. That's been a long time.
Yeah.
Yes, so we've gotten as far as we ever have, much work. Marketing continues. We looked at stats for our website for FY '25, and there were more than 17,000 views, a lot. What else? Our number of incensed by the cents we're spent continues to increase as compared to last year. Unfortunately, next month's report is going to be non-existent because of the spectrum issue, and not being able to operate that sensing thing. Another reason to have a hard copy of the scoop is we are struggling with the current publisher regarding enough, they are getting enough advertisers to make it free for the city of Worcester. So we are likely gonna be changing publishers' formats. May not look as shiny, but it will be easier to read, because it's some very small publisher. So, work in progress, that's a big strain on our staff at the moment, but hopeful. Linda, you might want to talk about the outreach. We continue to collaborate with fundraisers, partners, and talk about whatever collaboration we might want to highlight in the next 5 minutes.
All right. So, senior services has been very busy this summer. And one good thing is with Rhonda not utilizing the space and we getting more space on the 3rd floor, 2 of the senior service staff now have larger offices. That just happened on Friday, so that's good because we are seeing more people and we're entering SHINE season, which stands for Serving Health Information Needs of Everyone on Medicare. And Anna Christina, one of the senior service staff, is a SHINE counselor. And we have Hazel, our SHINE counselor volunteer. So the calls are coming in and we expect them to be very busy, so it's a new bigger office for Anna Christina is welcome, because oftentimes they have 2 or 3 people maybe in there at the same time, if it's husband, wife, and someone else coming to hear it, because it's all very confusing. And we continue to outreach and advertise about the Medicare Seniors Savings Program, and hopefully we'll get more people on that program. We're also, Anna Christina's been busy. I don't know exactly when this started, if it was before we left for the summer or not, but she started a drumming class. And a drumming class is not with real drums, it's with buckets and noodles, and they do that to music. And we're having our multicultural annual event on the 29th of October, and they will be performing at that. That's one of our big programs for October, as well as, if you see on the front page of the Scoop, the Music and Dementia is another one of our big programs that's happening in October. As far as community outreach, the senior service staff has been out and about over the past few months. They went to Worcester's Night Out, and I know I didn't say it correctly, the title of it, but at University Park. They did a program over at the Girls Inc. a few months ago. We've been on a few outreach programs with Maddie. She went into senior housing and did blood pressure clinics, and there were vendor tables from the city and community agencies there. So, and it's brought in some new people as well. So we're very happy to be doing that, and since we have a larger staff now, we can have people leave. And we continue to work with Southeast Asian Coalition, with Elder Services, with REC, Regional Environmental Council is still here. People are still utilizing that, along with the farmers market coupons. It was in there that we gave out at least 300. So we were busy that day, and people are using them at the farmers market. So we've just been growing and going, and hoping that this winter we do not get a lot of no heat calls, no money to pay for heat. Food insecurity continues to be a concern, and we all know housing is ongoing. That's what we're busy with, so.
So related to that, I know that now there is a program for anyone under certain, income, they are eligible for basically 50% off for their electricity and gas, right?
Through the National Grid, anything, or do you mean Worcester Community Action Council fuel assistance?
Oh,
There's
what's
the fuel
difference?
assistance
Yes.
program, but then there's discounts, low-income discounts with National Grid too, based on. So generally, people who have received the fuel assistance through Worcester Community Action Council also get the discount on their National Grid bill. I don't know, the 50% off, if.
That was, substantial.
Yeah.
A substantial discount. But what about those elderly folks who live in maybe their personal, private homes and have a heating oil? Is there a program?
Worcester Community Action
That-
Council covers oil, electric, gas, propane,
Oh.
wood, coal. Yeah, it's limited though as to the amount of monies each person can get. So we'll see. And it all depends on the cost of how much the fuel is this year. Gas, electric, oil. And people can't get shut off through the winter months with gas, electric, but oil, they do not have to deliver it. You don't have the money. And those are the people that we really worry about, because if it's a cold winter, they might run out of funds. Years ago when I started, there used to be other agencies that would help supplement the fuel assistance funds, but if anybody knows of any, let me know. We have an intern who started last week, and one of her responsibilities is going to be to make calls to different banks and realtors and other organizations to see if they have any funds that they ever give out for emergency situations. Sometimes I've learned from other senior centers, sometimes they have it, they just don't advertise that they have it, right? So we're hoping maybe that will help, if it exists. I don't know. But we're looking at all avenues to help people. Snow shoveling will be another issue this year. Our volunteer list is very,
However,
we have Central Mass Housing Alliance with our elder home repair are going to do some shoveling for us. We've got some funds to help with that, so that will make a difference to a few people in the area. Yeah, that we can call them when we have someone in need. Yeah. The problem is, like last year when we had the snow and then the ice, and people didn't get it done in time, and then they called because nobody could get in or out because it was all iced over. But we're not gonna have that this year, I hope, and they will come through with shoveling for us. We hope.
Linda, you might want to add to your list the Memorial Foundation for the Blind. So it's a board that meets once a month that pretty much, if you need to be diagnosed that you're legally blind or have a progressive disease that will lead to being legally blind, but they will do assistance up to like 3,000. I think it's 3,000 every 2 years that they can give out to people if you. So there's a website and everything that you can go on to fill it out.
Oh, that would be great.
And we do it's mostly equipment that gets given out, but we've also done like memberships to the Y. We've done anything that is going to make their lives better or easier. So we might be able to utilize that a little bit
For some, emergency type
Right.
things, yeah. Some people just need a little bump, you know, like just to help them over. It's,
So sorry, I have to run to another meeting.
Thanks. I try not to be doom and gloom, you know, we have to take one day at a time, but at the same time, I have to start thinking about anything that could help people who call us.
I'll send you a letter.
Thank you. No, I wrote it. Thank you. We can look at that too. So if anyone has any ideas or comes across anything of some organization that might have, you know, even $100 to give to someone, that's, that's something.
Thank you. Does anyone have any other questions, any comments that they would like to bring up? On the back of your agenda for today, all the dates for our upcoming board meetings are on there so that you'll have them and not be like me, come last week.
Better you were early than not coming up.
Right. So if everybody is all set, do I have a motion to end the meeting? Yeah.
Motion.
Thank you. Do I have a second? Second. All in favor? Anyone not approved? So approved. Thank you all for coming, and we'll see you again next month.